Wake up. We gonna do this one the right way. Groove. Smooth. Ooh. Wake up.
This the feel, this is soul. This the feel, this white gold. This the real, break the mold. This the feel, don't let go. This the feel.
Class in session. Hi everyone, welcome back to our podcast. You're watching Class in Session with the Inspiring Ed. Today I have Ghowash with me. Can you tell me a little bit about yourself?
Hi Abigail, thanks for having me today. And yeah, I'm happy to talk and chat and have fun with you.
Yes.
I am sixth year doctoral candidate for PhD clinical psychology program at Montclair State University.
Woo, woo.
Yeah, and I also teach as an adjunct, and I'm also a researcher. So I'm a team lead researcher in the interdisciplinary lab, that's called RO's lab. And I've just started as a new role as a SI faculty specialist in the CAST department.
That is so amazing. Well, I just want to give a huge shout out to Ghowash for being in the doctorate program. That is a lot of time and energy, and for also to be in the Inspiring Ed is in the doctoral program. I congratulate you for doing something such a big achievement. So can you talk about your role as being the in the CAST and what that's like? I'm so sorry.
Center of Academic Success and Tutoring. Yeah, so I just started this week, and what we are doing is also when I was teaching. So most of the courses we see that how students are failing in some courses that's very required for their program in different departments. So what they did was they assigned some peer leaders that's called supplemental instruction leaders, SI leaders. So I worked with few of them, and then they gave some feedback that how can we improve it. So they said, okay, yes, you have worked with so many SI leaders, so why not you join us? And so I'm conducting a research how faculty is thinking about it, how they make it work, and how can they support SI leaders who work with them, and what is working, what is not working, and also asking from students who are availing these peer leaders to prepare for exams or work on their assignments and just learn about the course materials that they need additional support, and they're hesitant sometimes going to tutoring or going to any other asking questions from professor, stuff like that. So we want to support our students to get help, and help is available, and and we want to see them successful. So yeah, improve their grades.
Absolutely. I highly encourage tutoring. I've talked about it multiple times, and I at first was a little hesitant about going to tutoring. I took a statistics class. Shout out to Professor Prusso. You changed my life. You encouraged me to go to tutoring because I was failing. So
that's when I was teaching last semester, the previous year. So whenever I recommend, they don't go, and why are they hesitant to get the support? You want to improve, you don't want to fail. So and over the course, over the last few semesters, we have seen how the failure rate is dropped, and students are improving their grades. And,
it's fantastic.
Yeah, and they are getting help that they need.
That's great. I ended up taking tutoring, finishing, and then passing the class.
Yes.
And I was so happy that, we have professors that genuinely care about the students. And I feel like sometimes students may have that, there may be a stigma where students feel like, my professor doesn't care about me, and I feel like that's such a false narrative.
Exactly.
However, I can't speak for a general population. I can talk about my experiences, and that my professors were always encouraging, and they said, if you need help, we have office hours, we have the tutoring center. I've gone to the tutoring center for other classes at Montclair State because I wanted to succeed, and I got that A. So from that B, I went from that A, and it was so thankful. I'm forever thankful for Professor Prusso for really pushing me to want to get that help, because it's hard. it's hard. It's really hard. There's a lot of pride. As a student, you want to do it by yourself. But once you can swallow that and you can be like, you know what, I like really do need help, and that's okay, and help isn't like a bad thing.
Yeah, exactly.
You end up being so much more successful, and then you make these connections from it, and then you can laugh about it like from years from now. Like I can laugh that like, you know, statistics is not for me, but I know that I got what I got the help that I needed.
You fulfill the requirement for your degree, and then if you are keep repeating failing, so like you cannot get the degree, right?
Exactly. And it ended up being really funny because with political science, there is a lot of statistics that is involved.
Oh, interesting.
So it ended up being, Professor Prusso, you were right. I was going to need it anyway. So I use it in my political science classes. But again, it's one of those things that we need to be mindful. And, you know, it's hard to say, just listen to your professor and take their advice, because every person is different. Everybody needs different needs. But yeah, like it's great that you're pushing students for academic success in the tutoring. So where's the tutoring center at Montclair?
It's in library, but my work is related to SI leaders and like bridging the gap between professors who are assigned SI leaders. So SI leaders are in the classroom, they attend the classes. Sometimes they may not because of the time of the clash, because they're also student, but they are mostly senior, or maybe some are freshmen too. But we analyze how much they know about the course. They have completed the course earlier that they are assigned, and they attend the classes. They offer, you know, their office hours to their fellows, peers, students, and you know, any student can join their office hours, get some help.
That's
so
great.
It's like it's internal system other than the tutoring. Tutoring is in, you know, library room 138, and then they just go and get the appointment for any subject they are struggling. But I'm working with like very assigned SI leaders and assigned faculty who really want to, you know, support their students.
That's amazing that there are students that are SI leaders that are willing to give up their time for other students. So that's phenomenal that there are other people that want to help and, you know, give them that need to push for that passing grade, or maybe that B to a A, or that C to a B, because every need looks different for a student. We just got to nurture it for what they need for their success. So that's amazing. So tell me about how you became who you are. So I know we talked about a little bit about education. We talked about you being a professor. What's that like? What was it like being a professor, and how did that maybe challenge you in some ways, or maybe it didn't challenge you? Or can you talk about a little bit about that?
Yeah, sure. So our PhD in clinical psychology program, we are assigned at least 1 year of teaching as a part of a professional training. So I started teaching in my third year after we complete the professional course. And I have taught different levels. I started with 4. I really enjoyed, you know, that like senior students like who understand, and like there was very smooth ride in the first semester. But next time I was assigned like something 200 levels, and then they found like, okay, students are struggling in a way that like they are adjusting to, you know, they are sophomore or freshmen who are adjusting. Sometimes there's like, this is my first semester and I don't know what to do. So I saw many students like open up when I create this space that, okay, so we are not only learning about research, like psychology research or experimental psychology, or I also taught one statistic course last year, and yeah, it was fun. So having assigned these different courses and understanding the students' need, I think my teaching is improved over years. Initially I was like, okay, this is a course you're supposed to do, you know, pushing students to be professional, take responsibility, accountability. But then I realized that I'm also a psychologist, like, you know, I'm under training. It's my 5th year training. So what we do with our clients, those who are struggling, and the more we know about our students, because they are struggling, you know, 50% of Montclair students are doing full-time job. So it's very hard, like imagining myself, like I did not do job, like full-time job and my grad study. So seeing my students struggling with time management, with you know, keeping up with the assignments, or not attending classes that they should, like so I, you know, keep changing my course requirements, absence policies, attendance policies, submission policies, and giving them like more and more support in terms of asking more questions, having one-on-one meetings with my students for different projects. And then I was also assigned SI leader, so that also helped to, you know, build a bridge between professor and students, like what they need, what they want. And also like last year I spent more time knowing my students more, and I used to have this round circle session at the end of semester asking like what are their struggles, and do you find any friend throughout the course, like make friend, know each other, build some, you know, team building skills, improve your research skills, talk about your research. So last semester we had we made one assignment as a public event. We call it Psych Tank, and it was a written assignment. And I was thinking for a long time, like, how do I redesign it? Then I opened the forum for my students, and they said, we don't want to write, because they already had one full big project, written project. So I said, yeah, I understand, I totally get it. Like, you need more skills. Like, what should we do? And they said, why not we do some presentation? I said, okay, that's a good idea. But then I asked them to, you know, design a poster just like we do in our research symposium or conferences. So design the poster and present it through their laptops, and it was a proposal pitch activity for them, and they invited their friends to come and, you know, join the event and talk about their project. And during that time I also learned many students were working in very interesting clinical setups or hospitals. I said, wow, like you are already in the, you know, psychology field and learning from your experiences out of the university. So that was awesome, like knowing my students, knowing their needs and helping them and supporting them, and sometimes doing the, you know, mindfulness exercises within the classroom. They really loved it, positive affirmations, and also referring for tutoring or offering one-on-one. So stuff like that.
How does that make you feel as like a professor, knowing that at the end, like you were providing those things, and knowing that you were listening to the students when they felt a little overwhelmed, and you were like, okay, we still have to do this assignment, but how do we engage it to make sure that everyone's succeeding in a level that works for everybody, and still making sure that they're held accountable?
Yeah, I like usually we do the, you know, it's a our university system that we have to do some midterm evaluation and the final evaluation. So around the midterm evaluation, we analyze how much they are doing in terms of grades. But I also look for other signs, that how much they are engaged in the classroom, and how much, like one time in one of my courses, I asked students like, why not we do one device day and one no device day? And they all agreed. I said, let's try this. Like one day you will be there in the classroom, just have a handwritten note, and 1 week you will allow to use your laptop. So that was also helpful for them to just see the difference, that even though if your laptop or you are, you know, making the notes, but you can be easily distracted. You know,
can.
Time span, like attention span of human is like 7 to 10 minutes. So after that you just distracted, and you just struggle to come back to the you know, lecture you are attending. So sharing these information, I think, was helpful for students to understand, like know them better, what system is helping for them to, you know, make in terms of making notes, or in terms of attending classes, in terms of preparing for the assignment or courses, asking questions, like encouraging them to, you know, ask more questions. And like sometimes I learn the names of my students so quickly, so I just like start calling by name. They don't like much. But I said, okay, this is also, you know, teaching technique, that where if you know your student by name, they may respond better, and they feel that, oh, my professor knows me, I should do better, be attentive, or, you know, participate in different ways. So yeah, I saw, like, if students are not much talkative, so I just encourage them, you know, hand raise, hand gesture, I will accept anything. Just, you know, show me you are attentive, you are listening, and you have some questions. So and also using some, you know, techniques like Kahoot or Mentimeter or something like digitally involved, and they're just like answering question, and then there's a like big cloud coming on the screen and showing these are the answers and what they're thinking about different things, showing funny videos, and having some more interpersonal connection. So I try my best. Like I'm still learning. I'm in the course this year. It's a teaching course that I just started this semester. It's a 1-year long course, and only 45 faculty members were selected for the course. So I'm one of them.
Congratulations.
Yeah, thank you. So I'm learning more techniques about teaching and how should I assign my time and to keep the students engaged.
I love that. I love that you also said that you know your students' names. I think as a student, when my professors know my name and they call my name, it makes me really happy. It shows that they take the time and effort to really know who I am. And for me, it truly does make a world of a difference because, as a professor, you put as much effort as we put in, right? And I'm not saying that, that's how I feel personally. Like when I notice that professors take the time to know my name and I have a personal connection with them because, maybe I'm going to office hours or I'm emailing them about a question or asking about what this assignment means or, maybe asking for advice. Some of them I look for, like mentorship and ask them like, hey, like, do you mind, like, would you mind if I, like, did some office hours so you could, like, mentor me for, like, an hour and, like, talk about, like, your experiences. And I've noticed when professors, don't know, I'm always engaged in a class. Like I love to learn. Like I'm such a bookworm. Like I love to learn. But I do notice that like I feel like there is a little bit of a disconnect. I feel like maybe like I don't really know that professor, and there is that like almost like a barrier, like a wall where it's like okay, like if I'm having this, think about like the 22,000 students at Montclair, they're probably feeling like the same thing as well. So I really appreciate you for knowing your student's name and taking pride in that, because for me as a student walking in and the first thing, like I'm going to give an example, Dr. Pohl, she also works in the CHSS. She's fantastic. I love Dr. Pohl. I really do look up to her. And the first day of school, she tries to memorize everybody's name, like that's on her list. And then by the second day of class that we have, she knows everybody's name. She takes time to know, and I take time to understand her as a professor, but as like a regular person too. I know that she loves to hike. I know that she loves to travel. I know that she loves food. There's like so many good things that like, I have a bond with my professor, and I think that's what makes that community and makes that Montclair very special, is that like, when you take the time to know your students, like it no longer becomes like the student and like the professor. It's like, you have a connection with the professor or a student to professor. It's like that nice, like almost like a bridge where there's not all that anxiety anymore. It's like, oh yay, like I'm going to like my favorite class with my favorite professor, because that makes a big difference. And I thank you for that, for doing that for students.
Yeah, of course. And I think there's so much more to learn. The moment I started this teaching related course, I also attended other symposium that happened last year in winter and summer, and this year also in winter. So every time we are learning new things. World is changing. We are living in this social media and digital world. We are so many new things are being introduced, and we still want our students to maintain that critical thinking and creativity and all that cognitive skills that make them successful. It's just not like they got the degree but they lack skills. So I'm more focused on skills, like learn something that you are proud of, you're interested of, and you can use in the future too.
What's your favorite thing about like teaching and being a professor?
There's so many things. Like I think I get some opportunity to motivate people to do something in their life, and it's like, you are my student. And I remember one student said, I failed this class 2 times, I just wish I pass. When like in our first day I asked like what are the expectations, and he said, I just wish you. I was like, no, you are my student, you will pass with A grade. And I said, okay, okay, let's see. And then he passed with A grade, and he was so happy that little motivation, space for students to express themselves, celebrate themselves. I also big on diversity, so I give extra points if they want to share their culture, background, or find any scholar, find any article that's related to their and interest or background or related to their identity. So I do that too, and students own that. Students feel seen and heard and say, yes, we want to present this related to my background, and they were like feel very proud, or they feel space where they can be themselves and still they have to do assignments on time.
Yes, of course. But I will say I love that about Montclair is that we are a very diverse school, and I love that in a classroom you're going to meet like so many different people from so many different backgrounds. I mean, there's so much to learn from so many people, and I'm forever thankful for that from Montclair and the diversity that I will always, it's like the richness of it. Like it's truly so powerful to have such a diverse school, and knowing that our school is so beautiful with knowing that it's filled with different cultures, religions, backgrounds, ethnicities. It's really, really like such it's like, I'm like warm from it. Like it's such a warm feeling, because even at our school, like they do ceremonies like every like right now we're in Black History Month, and they did the flag raising. Like that is so beautiful. Like that is so amazing to know that like for Women's Month they had a flag for Women's Month. For I believe there was one for like the month for like there was like a Italian like something, and they did that for the Italian. They did one for Hispanic heritage, and it's just amazing to know that like Montclair takes a lot of pride. They take so much pride. They do one for Pacific Islander. They do one for every month. Like every month, someone's always being celebrated, and I love that about Montclair is that we're always celebrating everybody. Like there's always someone to celebrate.
Yeah, I'm also a member of Asian American Pacific Islander, and we have a full list of events happening in February and March. We have one very coming next week, a lunar year. We are celebrating that. So I also encourage my students to go and attend, do something.
Yes.
I will give extra 10 points. Just do something that help you to be yourself and explore yourself and have a good experiences while you are on campus, because many students just don't attend. They just go attend their classes and go back to, if they are commuters. So I highly recommend just attend, and I will give extra marks.
That's very kind. Yeah, that's very kind that you're giving encouraging students and then getting rewarded to go. Like that's very kind, and I wish some professors would do that to encourage, because I was having a conversation with Dr. Kopel, and he was saying how do we get more commuters and how do we get more students involved in general? And I was telling him, I'm it's just that conversation, having that conversation and having it with students, because it's a domino effect. Exactly. I tell one student, another student tells that student, and I was talking to these students and they were like, oh, I'm going to this one event, and that other student overheard and they're like, oh, I'm going to that same event that you're going, and they ended up walking together to go to that event. And that right there shows community, but also shows allyship, in the sense that there are people that know about things, there are people that are going to the same events and having a good time. And it's true though, I do wish, there's 22,000 students at Montclair. I want all 22,000 students to go, but at least have half. If I could have half the campus be involved on campus, I would be thrilled, because the amount of experiences that you've gained or you can gain from being involved on campus, being a part of the future educators, I was able to go to Atlantic City. I was able to see Malala speak. That's something that I wouldn't have gotten if I wasn't involved on campus. Exactly. So I really highly encourage students, even if you don't want to be committed to a club, that's okay. You don't have to commit yourself to a club, but even just attending a panel or attending a workshop, or just doing something that is not something that's commitment, because I think a lot of the students I've talked to, they're too worried about commitment. They're no, I can't do this commitment. And I get that. As a student, I get that. And I want to respect that, because I want to respect the needs of students and what they need, because some students want to go home and they want to just decompress when they get home, because of, everybody has a different life. But if you just spend an hour, we spend hours scrolling on TikTok or YouTube or whatever. Like, I'm sure you can give 45 minutes to go to a panel or 45 minutes to go to a student involvement fair or 45 minutes to go to like an event that like Campus Life is doing, whatever it is. Like, there's just so much. Like, they offer free food sometimes. Like, they had a potato event, like a potato day, and I had tater tots, I had a baked potato, I had French fries for free, and I didn't. And it was at the student center, which right across they have like all the food with the Panda Express, with the chicken place. There's like a sushi place. There's like the halal place, and all of it's very good. But I like free. Like, I'm not gonna not take free. So there's just so much opportunities where students are, you know, they could benefit from. Like, they could totally benefit. So it's really kind of you to encourage your students. And the fact that they're getting 10 points, I wish my professors were telling me. I would get like 10 points on everything, you know? But at the same time, I think it feels good knowing that, you know, you're spreading the word of Campus Life and being involved and, you know, your club and just like what's available on campus. Like, I think there's a, you know, I don't want to say there's a lack of, but there's always awareness that needs to be spread anywhere.
Yes, a little bit encouragement, like, you know, something's happening. Like, if you spend half an hour to any new event, different event, you will learn something new, different, and that will, you know, open your mind, open your imagination. It's so good for your cognitive development to go to unknown places and talk to people with whom you never met, and maybe you never get chance to talk again. But, you know, giving yourself some challenges increases your neuroplasticity. So yeah, that's why I like it. I attend all events all the time. I just, you know, every week, every Monday we got the loop email and see okay, which matches with my, you know, schedule, and I try to attend those things.
Yeah, as you should, because you know what, that's going to expand your knowledge and expand experience for you, and maybe even open up the next door for you. Like, you know, I always believe like one door opens, another closes, and then another one opens, you know, and that could be an even bigger door.
Different foods, different people, different, like this Wednesday I met the cop for the first time, or university police for the first time. So yeah, that's good. That's awesome.
Yeah,
we can talk to the different professionals in different events with free coffee and food.
Absolutely.
And, like, different food. So I had a lot of snacks this last semester. We were celebrating International Week.
I remember.
There were so different stalls of different countries. So I got to eat so many different snacks I never like ate before and did not know the history and the culture and the color. So yeah.
Do you participate in World Fair Day?
I don't remember this event.
So last year they had a really interesting table. It was a water table.
Okay.
And they had all these different waters from like the world, and isn't that like so interesting? And I got to try Japanese water, which was like really crisp. I'm not gonna lie, it was like very crisp. And then I got to try Australian water, which felt really dense. So it was really interesting to try all these different waters, because you like something like basic like water, you wouldn't think like would be so different wherever you go, but just as, you know, water, like wherever you go, things are different. And it was really cool to have like an experience of like a taste, like they had a table of taste tasting of waters. And I believe the culture fair is in April, but it's free. It's free. They have all these vendors that come and clubs that are like a part of like, you know, like a culture or religion. Like they're able to like come and support their table, and it's really cool. It's so cool. The German club was there, and they were giving out like these really cool like soups. It was really cool. There was another table where they were giving out like. I can't remember now, but they had like all these different tables, and they were giving out free food.
Wow.
So you had me at food, because I'll try anything.
Yeah.
I will try anything. I'm a foodie. I love food.
I'm also foodie. So yeah, I like tasting new food, understanding like how do they make it, and like knowing that, you know, that's a part of their daily living. It's so interesting. It
is. It's really nice, and to even have that, like, the fact that Montclair even offers that, I feel really lucky. Like that Montclair really does highlight that, and they do highlight like the importance of that, and I'm really happy to be a part of that.
Yeah, so you asked the question earlier, how did I become who I am? So I think that's big part of going out, going into the events, attending events, learning more, what I like, what I don't like, or meeting people. And social connection is a part of my personality, I think. And I love meeting new people, knowing their backgrounds, and just understanding how they are doing in their lives, how they have become successful. Yeah.
Absolutely. We're going to move on to the second segment, and this is, why does mental health matter and why mental health? So my first question is, what does mental health mean to you?
I am in the field of mental health for like 9 years, more than 9 years, like when I was studying undergrad. So yeah, more than 9 years. For mental health, I think it's a lifeline for me. I feel that people who are struggling and everything is fine, everything is functioning, but if they have mental struggle, so still something is missing in their life and stopping them, or that's a barrier that they should work on to move forward. Like live free of anything, any fear, shame, guilt, whatever is attached to what they have gone through in their lives, and whatever they have hit directly or indirectly in their lives. So it is a range of struggles. I feel that mental health for people who are not even diagnosed for any disorder, still they need that support to keep it moving, right? Because when you don't process your any problem or disorder, don't get treatment, like whatever the range is, range, moderate, mild, so in your old age, or your maybe youth, or your adulthood, will be suffering a lot, and you cannot achieve your goals, you cannot do big things in your life. You everything accumulate, like they don't go away. Mental health problems don't go away just if you ignore, or your time doesn't heal. So you have to work. It's your investment in your success, in your a better life or quality of life. So yeah,
exactly.
For me, it's like it should be a part of every day's routine, that work on physical health, work on mental health. This is how everybody should be living, I think, in this age.
Absolutely. I try to be my best at being about honesty, and I have started going to CAPS. CAPS is the Counseling, Psychological, and Services, and I feel like on this podcast we can always be very honest and vulnerable, and that's what I love about this. It's a safe space to talk. So I recently lost my grandmother, and the first thing that I did was I was like, okay, I need help. Like I knew that in order for me to be academically successful, I need to make sure I take care of my mind, your mind, heart, spirit, and soul. And so I am so thankful that CAPS is completely free. Like I'm so lucky that, there is like a counseling and services, like there is an office for that. Like I'm very lucky for that. And the fact that in New Jersey in general, like if you're a college student, UWIL is free. So even if there may not be like a counseling office, like students are still able, because of the grant that we were given, to go and have UWIL. So there is like online therapy for students if they don't have that option of going. And I'm very lucky that, at Montclair, they have so many different specialists and certain types of therapists, and the therapist I'm seeing is a grieving specialist. So I'm very lucky that, the person I'm speaking with is helping me through grief and like understanding grief and the process of grief. And I'm really proud of myself to be talking about this on camera and not like break down and cry, because it's such a personal matter. But I think going to therapy and talking about that and understanding what I went through, and like the loss of my grandmother, and like how she was very important to me, but understanding like how to move forward, right? You don't want to be stuck in the back, but how do we process moving forward? How do we continue to be living in our daily lives and moving for success? So I'm doing CAPS. It's going really well. I even joined they have a group therapy and I am a part of that. Yesterday was my first time ever doing group therapy. I've never done group therapy, so I had no idea what I was doing. And I just went in there with an open mind. I said, you know what, I don't know unless I don't try. So I went in, and the counselors were amazing. I was very nervous, I won't lie. Like I was like, I didn't know what to expect. We're all going through, it's for grieving. It's for someone that you've lost. And, I feel very honored to even like that Montclair even has something like that for students and that they have something like that. And my therapist was the one that recommended me to be a part of that. So I'm really lucky that she encouraged me, because at first I was hesitant. I was like, I shut it down really fast. But then I asked myself, why am I being so closed-minded? Like, why am I not going to try? Like, why am I already giving an answer that I have not even tried? Like, if I try it and then say, you know what, this wasn't for me, at least I put myself out there and I know that this didn't work out for me. But already saying this isn't going to work out for me is being so closed-minded, not being open, not being honest with myself. And the fact that, I went to group therapy, and it was actually like, I don't want to say like it was a great experience, because it's a very sad and emotional experience. But for me, like, it was like a step forward. Like, it was like I felt like there was a community where like that like understood what I was going through. And I felt like there was that safe space, that in the sense that like I did feel safe. I was like, okay, like I'm allowed to like literally cry my eyes out, and I felt safe doing that. And I'm really, really happy that Montclair offers that. And if you are currently grieving, or you're dealing with a situation or anything like that, please don't feel afraid to call 988. That is the hotline for mental health. If you're ever in a crisis, please dial if you're ever in a mental crisis. Don't be afraid. Secondly, it's okay to have help. This is very serious. And we always want to talk about support and how to get support. So if you're a student, try to go on your campus website and see if they have any psychological or counseling on site. Try to see if UL is on the website, and talk to someone who can get you the help that you may need. But that is a starting point for how to get help.
Yeah. First of all, I'm sorry about your grandmom, and I'm proud of you that you are taking all the help that is available on campus. I have shown my students how to get the appointment. They're just like, we don't know even like how to do it. So I said, okay, these are the few steps, and just go, maybe let's talk, maybe start with a small, like go to 15-minute session. And you're right that taking help is also difficult in so many different ways. There are so many layers of getting help. Like, for example, if you haven't seen in your family getting help, if it's related to your culture, like your culture says, oh, mental health doesn't exist or stuff like that. So these are the things that put barriers in students. And also that, oh, I don't have time. So if you don't have time, like, I feel that this is investment on yourself, in a way that this is your problem, and you are getting professional help. Why? Because they are trained, as you said, grief specialists, so they are trained what different people process things differently. It's never be the same thing. You can overlap with, like in group therapy, you will say, oh yeah, this is what I'm like, you can relate, and sometimes you can not relate with the things because of so many different reasons. So this is your space, your time, and you are investing in, you are like, pushing yourself and challenging yourself. So go there to get help. And sometimes the help doesn't feel the right away, right? It's a process. Therapy is always a process.
It's a process.
So it's like it takes months, years to get to the point where some people just deny, right? In the beginning, it's like, we don't need help. Who needs help? Like, we'll be fine. And then after years, they say, oh no, I really need it. So once you start, you feel that, okay, something is happening. I don't know if it's like, feel nothing, or sometimes people just quit because they don't understand the process. So many times what we do as a clinician is like, we explain what are the expectations, and explore what do you think about taking help. What are you looking for? Do you have any goals? What do you want to work on? Like, we can stick on initially 3 prioritized goals, treatment goals, and we will go from there. So yeah, being consistent to whatever you are looking for in terms of therapy is important than liking or disliking. Liking is like, if you like, maybe you don't gain much thing because you may be chatting or something like that, but you are not doing the therapy. If you are not learning skills, if you're not implementing in your life, and if you're not focused on improving, so it's sometimes many people don't take feel the benefit of therapy. And there's must be some awareness about that uh, believe in the professional, and you can switch to any other professional if you like. Maybe there's some anything that you just don't click with your therapist.
It's true.
You can switch to another therapist where you feel more comfortable for many different reasons, but just don't quit it. Quitting is not answer.
I agree. I feel like, I saw, back in like 2019, 2020, I was seeing about 3 different therapists before I finally got my therapist.
Okay.
And then when I went to Montclair, I felt very successful. I was on the right track because, therapy shouldn't be like a long-term thing. At least that's what they explained to me at Montclair. It should be something that is temporary, and if you need it for a longer time, that it's there for you. But if you're ready to be back on your feet and you're ready to go back, I think that's great that it's, it can be short-term, it can be long-term, it could be like whatever you decide, because it's up to you as the person. And I was, after CCM, I was like, okay, I'm ready, like, I'm great, I'm gonna tackle the world. And then, unfortunately, my grandmother died, and that was so sudden. Like, it was just, it was like left field. It was like no one knew that this was coming. It was just so out of the blue. And I was really proud of myself to be like, okay, like, we're not going to do anything right now. We're just going to set up a meeting with CAPS, and like, we're going to just work on this. And because like, this is my last semester at Montclair, and I was like, really, Grandma? Like, really? Like, I'm graduating, but peace and love, Grandma. It's just like, it was just like, you can't like reverse time or anything like that. But I think this is like, something that I can definitely learn and like grow and like, also share with other people who may be going in the similar experiences in the future. And it was interesting because yesterday in group, like, we were learning how like a lot of people will go to the doctor's office before they actually go to therapy. And that's because like they'll have like, I have a headache, like my throat hurts, like I'm having like blurry vision, like I'm having like I'm not sleeping well. So they think like maybe it's like sickness.
When symptoms sometimes come first, then mental.
So that's what they were saying. And I thought that was really interesting because, it's true, like a lot of people will go to the doctor and be like, I'm sick, like I have all these things going, when, the group, the specialists there were saying like, you might actually be like, you might actually have symptoms of a broken heart. So there might be something, but it's not something that it's actually on the outside, it's inside that we can't see, which is a broken heart. And I was like, that makes sense. You know what I mean? And it's just so interesting that like, like when you deal with like a heartbreak, or if it's like a mental health or anything like that, like you will see signs of like headaches, dizziness, blurry vision, forgetfulness.
Back pain, shoulder pain, back pain. So we do many different exercises when we go do the body scanning or progressive muscle techniques. So they realize, oh yes, my jaw stuck, or shoulders were frozen, or toes. Like, your body is sometimes telling you something is not going right, and we just we don't pay attention until it reaches to breaking point. And also during therapy, you may notice that we just like don't focus on your brain or thoughts or behaviors. We also focus on body too, because I'm like great believer of biopsychosocial model, where I feel that your body should be also taken care during that time when you see, oh, I'm not sleeping well, I'm not eating well, I'm doing these things, I'm eating some unhealthy food. So that's like holistic approach of taking care of yourself, that if you don't eat, so it may increase your anxiety or depression, or maybe you are having heavy depression going through like phase, and then you don't feel eating or sleeping. But that's not the case. You have to continue your circadian rhythm
Yeah.
where you have to eat and sleep and do stuff on the right time, and just keep pushing yourself, doing right things so that you improve your mental or physical health.
And one thing I learned is that nothing is permanent. Nothing is permanent.
You can change anything. You can learn
Yeah.
and unlearn
Yeah.
many habits, many behaviors throughout your life.
Yeah. Let's see. So what inspired you to focus on mental health and become like a mental health advocate?
Like I said, I feel that not only like people, cannot make progress in life, or there are so many successful people out there, but they are also suffering from, mental health disorders. And when we see them and we say, oh no, it's just normal, like people go through it, look, they are still successful. So I look differently. I see like you don't know what's going on in their day-to-day life, how much they are struggling to put smile on their face, how much they are struggling to go into media or social media or do whatever they are supposed to do. They are maybe under contract, they have to make the living, they have to manage so many things, and we see many people around us doing whatever they have to do, like maybe at their best quality. But mental health is something that is neglected in many cultures and many societies, and we have consciously changed the labels, right? Many problems or disorders were not in our DSM diagnostic manual in psychology. We had not, but over the years we learn, like we are learning behavior, we are learning disorder, and we are trying to make it more understandable for the society. And getting diagnosis is not, you said, end of the world. It's a good thing. Like if you're diagnosed, it's a good sign, it's a good thing to move forward, to work on, to focus on things. Many people don't even get the diagnosis because they don't fall exactly the threshold of diagnosis. So what do? It means like, oh, I don't have because I'm not diagnosed. No, you still need support, you still need help.
Exactly.
To just avoid reaching to that breaking point of diagnosis, and then things change. Then you have to do you have to go under medication. So therapy, I feel that work along with medication, because they sometimes need with medication, like under hospitalized or residential program, they are taking both things, medication and mental health support. But those who are just like outpatient in clinics, outpatient clinic, they also come for therapy. And once we see that it's going to severity level, we have to have refer to another professional to get some occupational therapy, to get some physical therapy, speech related therapy, or go to the nurse or doctor for severe physical problems that cannot be solved under just having a therapy. So we have like very interdisciplinary kind of approach, and I love that about psychology, that we work with so many different professionals in different settings that give a holistic care to the patient or client. And coming from my background, I'm Asian, so I have never seen this culture in my society where we openly talk about mental health, or you share, oh, I'm going through stress, and say, oh, they have solution for everything. So they do this thing, you'll be fine. Go take a walk or do this. So we of course, this is things work, but if you need a professional, so you have to have talked to professional. It's, even though you have a family support, even you have friend support, but still they cannot drag you out from the severity level of any disorder that you are suffering. And I think more help is good help. The more you explore things, the more you seek for help is available, support is available. And that's my advocacy, that you should, even though you have everything in your life, if you have any thought that you cannot discuss with your any friend, family, so of course there's a professional here where you can go to therapist, share, process any kind of thoughts, and explore why they are coming from where it's what is the relation with your thoughts or behaviors from your past, from your any problem that you are going through.
I love that. We're going to go on to the third segment, which is AI and the future.
Okay.
So what is your opinion on AI?
Oh, I love that.
You love AI?
Last year I pivoted to AI,
Okay.
and I saw that there are so many technical background people, like technical professionals, are into mental health care programs and AI apps or journal apps, and it fascinates me actually that how can we use AI for different level of care, and it can help many people to seek professional help. It has answers, but it may or not correct answers. You have to, there's like separate topic of AI literacy, like who are users, how should we use it, how should we use it in our benefit, and we just should not get distracted or uninformed or take the wrong information from AI. So I pivoted just to explore new things. I completed AI entrepreneurship course from business department last semester, just to learn more about, because I'm from non-technical background, psychology, so I wanted to learn more about it, and I'm also working on AI app also, like intervention app myself. Like I've created this foundation to help patients to how to more compliant with their therapy process. One day you go, you're so highly pumped up, motivated. Yeah, these are my goals, I will do it. And then next week you just do nothing, right?
Yeah.
So you go back to therapy, and many times, like, I ask patients, like, what happened? Did you do what we talk about? And said, oh, I did not get time. There's so much, daily motivation or efforts is involved in the therapy process that patients struggle with that, and then it's all up to them to do it. If they don't do it, they will just come back blank after a week, and they say, yeah, these are things I could not do because of the time. So I'm trying to do something for the people who are in therapy, and they struggle with the compliance to the process. But other than that, I attended different events. I was a guest speaker in a mental health summit, tech summit in October last year. So I talk about how can we use AI, and there are so many ethical considerations in AI that we should consider before using it for any diagnosis or a treatment related process. But it's still useful, and people should use it.
Yeah, I was going to say, I feel like a lot of Gen Zers definitely use AI for therapy because it's free.
Yes.
And they are already on their phone, and they don't have to leave their house.
Yes. So, and then we have seen so many incidents because of using AI, it's making it soulmate kind of person, or go to a mental like go to therapist. So I just got approval for a study for the AI usage among college students to process their trauma.
Wow.
So this semester I am leading this study under RO's lab. It's an interdisciplinary lab. So I'm mentoring one undergrad student. We will do this together this semester, and we'll share your results.
Yeah, definitely keep us informed. That sounds really interesting, especially how AI is definitely going to be integrated with schools, because AI is not going backwards, it's only going forward. So I feel like, I attended a panel last semester on like AI literacy, and I can't remember the man who spoke, but he like works for like the UN. I don't know if you were there. I have no idea.
The event I attended, the UN simulation event.
No, it was like a man speaking, and he was talking about like AI, like being AI literate. Like he was like talking about like the AI literacy and like how to like correctly prompt something versus like not.
So the AI event last 2 weeks ago, I think it happened. The one.
No, it was like last semester.
Okay,
Last semester,
Okay.
yeah.
Okay. Yeah, so we are having AI distinguished. Oh, guest speaker. I think you are talking about.
It was a man.
Yes.
Yes.
Okay.
Yes.
Yeah. So yeah, I attended the greet and meet, and I also attended the other session that happened last, I think 2 weeks ago, on 4th, February 4th. So I'm glad that universities, they started with faculty first. So last year it was more about how faculty can use AI. They introduced different features on Canvas.
That's cool. I had no idea that was even happening.
Yeah, so I attended the summer symposium I attended last summer. It was all about training faculty how can they best use AI rooms for many different reasons. And then this semester, and even like last semester, I'm observing more, they are involving students, inviting students to come to the talks, ask questions, explore how can they still be creative and then use AI. And I know like many students use AI. I like just see at the assignments, like one student did the assignment, submitted the assignment, it was a research paper, and it was all written by AI. And then when I pointed out, they were just like, no, it's not. I said like, okay, I can identify easily that this is not we discussed. This is not like I usually go through, like, break down the big assignment and then ask them do step by step and have some help, have some meetings, so I know their topic, I know what they are doing, how did they conduct. So this student like did nothing, any step, and just straight submitted the
assignment?
AI written assignment. So
wow.
Yeah, so just to avoid these kind of dishonesties from the students' life, like you can still use AI, but like use it wisely. You
can use it for like an outline.
Yeah, just brainstorm, but have something in mind and be creative and like keep your thoughts intact, like you are still leading the project or assignment that you want to work on. So AI is good for text generation. It can generate text for anything just quickly in a second, but the content is still important. The content, the quality of the topic is still important, that humans should take lead on and work on that. I just remember one thing about AI. I skip my mind. Yeah, so next month I'm going to speak cultural biases of AI in digital mental health in international conference in Italy.
Wow, you're going to Italy? Okay.
No, it's an online conference.
Okay,
but it's in
online.
Italy.
But that's really cool.
It's happening in Italy, so yeah.
That's cool.
I will be, just learning about sharing, and many people don't know. Like many people don't know the clinical insights from any psychology background person to share about how to explore, how users are any people who have any background, but if they don't know the nuances, that what should they look out while interacting for with AI for their own therapy. So that's not the same thing. There's still difference, and they should definitely go to therapist for their for the professional support. And just last night, yesterday, I got selected for APA AI advisory panel.
Congratulations.
Yeah, thank you
that's
so much.
Exciting.
So that's a rapid APA AI advisory panel. I'm still learning. So yeah, I applied there to be a part of big organization and talk about it. So we will be working on analyzing different psychological tools, AI psychological tools that are available for the users, and help like people to know better what kind of AI tool is best for them, and spread awareness about it.
So my next question is, how do we use AI in a classroom? Like, what is like the appropriate way because we want to make sure that our work is still being done appropriately and that there's no unethical, you know, like you explained about your one student using like an AI research. How do we use, in your opinion, AI correctly in a classroom?
That's a very big topic, and we are still learning or exploring good ways. And what I have learned so far is, when you are assigned any, like for example, you are attending any course and you struggle with understanding it, so you just chat with AI to explore more, or what is this assignment about, like help me explain this question or understand how can I better answer it, right? Then for the big assignments, like I did research, so there are so many steps that you have to first talk to your professor or peer about what you want to, like even group study, you have to explore the options or ideas yourself, and then maybe then like AI comes later. Your brain, your ideas come first, and share idea with AI and like say, well, what is feasible, how can I do that, is there any other methods I can use, and how can I use it quickly. So you can chat as a assistant. I feel it like AI is my assistant that when I'm chatting is just like, okay, we are brainstorming and but students should know what they are doing. If they just come up with blank headed and then just don't know where to go and put all the burden on AI. So AI, whatever the AI will lead, and it's open source, if it's not configured, it's so they don't know even the language related to every field, the terms that they use in every field, the way they should write their assignments. So they can lose a lot of self-confidence just depending on AI. So I feel that you can use for anything, but don't depend on AI to do your homework or do your stuff. And then when professor asks what did you do, and they have no idea, like how did they solve the problem or how did they answer, like it doesn't make sense, like you gave a different topic, but then your hypothesis or your method are totally different. It's like different. Explain, and then they cannot explain things.
Yes. I definitely will say from like a political science like background, like, and someone who enjoys like policy, I definitely think like AI needs to be held accountable, and I hope to see in the future that there are laws in place in education so that we don't see like essays being written now from like AI. Now I use it for like making like outlines. I love it making for outlines. I'm like, okay, I need to make an outline. This is my idea. This is my hypothesis. And like I will think of my own stuff, and then it will help me create like an outline that I need, because I'm a very like structural person. But I will never like, or maybe I'll use like Grammarly. Like I'm not the best like grammar person, so I need a little help with that. But other than that, like being held accountable within like an academic sense, like I would love to see that happen in the future. But again, I'm not sure. I don't know what the future looks like because I'm not a fortune teller, unfortunately.
Yeah, so AI is like, if you do the research, so it sometimes make up the facts, make up the like fake information and create fake kind of references. That's very harmful for students who just don't double check things. So many times I have seen, look, this even the reference doesn't exist, so it means that you just copy paste it from AI, and that you didn't even check that you are submitting the correct assignments. So that's very important for you to double check the facts, and find the true resources, and that like finding or searching the correct information that you want to add in your assignment. That's what the humans do. Like, and AI makes easy, but then you have to double check what are the source. Is it authentic? Is it approved or peer reviewed? Is it journal? Is it published? Or it's just something that you cannot even use for your
exactly assignment. Exactly. We're going to move on to the fourth segment, which is motivation and community impact. And this will be the last closing of the podcast. And I've had so much fun talking. Ghowash, I've had like the best conversations so far. I'm enjoying my time. I hope you are too.
Yeah, of course.
What motivates you each day to continue the work you do?
Okay, that's a great question. I feel that this is also something recently I have started doing. I always found myself like, self-motivated kind of person. Like, I'm excited for things. But then I got into grad school and then, excitement of different things that you're interested versus what you have to do are two different things. So navigating life through being in the grad school and what should be done first and what should you do. Sometimes it's time taking, sometimes you are not interested. So recently I'm just learning this thing that motivation is of course very important, but also just doing it anyway. Like there's like phrase I just heard from someone's podcast. The guy was saying, do it anyway. This is my mantra. I said, okay, this is good. And then I started doing it myself. Like, if you are even interested or not, if you know this is your deadline, this is the goal of the day, you have to do it. Just do it anyway. And then after doing it, I feel like more confident, more feel accomplished that okay, I did it. Like I did not want to, but I did it. So finding ways to motivate yourself is also important, and finding inspirations. Having a good group of people or following those professionals that are your that you want to be in your future. So taking all those vibes from any person, in person or online, I think that I create motivation for myself to do things, and I have so many goals. I have like so many goals for this year, and like I'm motivated to achieve all of them.
Yay!
And I feel that other than motivation is like determination is also important. Like I don't forget what I want, and I just don't get lost with other distractions. So I stay focused, and I just like make a to-do list and keep revising it and just break it down, chunk into small achievable goals. So it feels like you are doing something. It's not like you have a big goal and then there's a like big gap. How will you achieve that goal? And what do you need? What resources do you need? So yeah, I think it's a continuous work. It's for me it's intrinsic and extrinsic, and I find ways to stay motivated.
I love that for you. And then, is there a final message or a takeaway or something that you would like to share for the audience?
I think it's my first ever podcast. I really enjoyed, and I feel that the message for any student or professional could be like, you can do anything you want.
That's it.
Yeah, that don't make any unseen problem like come into your way. The self-belief is something that comes after you do it. Yeah, it's my new learning. I felt that when you feel ready, then you do things. I was just thinking, I will once I get done with my degree and then we'll do something. But then I found someone saying on LinkedIn that just do it anyway, or do it right now. Like you can still achieve what you want. Don't wait for any degree or best or perfect moment to come in your way and then take you. And since then I started working on that, and I found so many people, so many connections, so many resources that I became public speaker then. Just knowing that I should not wait for one perfect moment to what I want to achieve. So I'm just surprised by myself that okay, I got so many things. I achieved so many things. I won very interesting Cold Spring Harbor Lab scholarship.
Wow,
that is
congratulations.
Thank you. That's very hard to get in, but I just like saw it. I saw the ad. I said, okay, this seems something good and interesting. I should apply. And I applied and got it. same happened with the other things that I applied for the becoming a advisory board member of CHSS. I just said, okay, why not me? And then I applied, I got it. I was surprised. Wow! So means there are people out there who will understand your talent, your potential, and give you opportunity, and you just take it. You should be like open-minded to things that you want to achieve in life, and just do it right now. Like, don't wait.
That's a beautiful message. That's a beautiful message. Like, yeah, I totally agree. There's never going to be that perfect moment. You have to take that leap and make it that perfect moment. And it can be difficult, but the fact that you said, like, what motivates you is just your own motivation, and that just do it. Like, just do it. I love that. Like, I love it, because sometimes there are days where I'm like, oh, it's so hard. Like, but I push myself just to do it. So it's totally very true. Like, it's relatable, and it's also such a powerful message as something so simple but something so big at the same time.
It improves your self-belief, your self-confidence, your ability to really get things done, compared to what you just think, oh, somebody hand me over something that you are not passionate about and you don't think about it. So I'm so happy to be here. Thank you so much for inviting me.
Thank you. Thank you.
I hope our message of mental health and all the stuff that we discuss reach to right people, and people get motivation, inspiration, and come to your podcast.
Yes. Thank you for watching Class in Session. I hope you enjoyed today's episode, and we'll see you in the next one. Bye.